Hi there, how are you doing today?
We're good. Thank you so much for having us today, Andrew. With me is my co-author and one of the director here, Don Williams.
Yes, very excited to be here.
Fantastic. So, could you just give us your titles, a short bio about yourself, your credentials, and state the title of the article you'll be talking about today, please?
All right, thank you. So my name is Rocel Besa. I'm the Director of Nursing Quality and Professional Practice here in Jersey Shore University Medical Center. Part of my responsibility is also magnet designation, which is we're very proud of because we have been designated 6 times. Now, as to my degree, I have a bachelor and master's degree in nursing and a doctorate in educational management. I have a certification in cardiac vascular nursing and nursing professional development from ANCC. I'm also a certified nurse educator and a certified professional in patient safety. Other than my work here in Jersey Shore, I'm also an adjunct faculty in Georgian Court University. And prior to my role here in Jersey Shore, I was the manager of clinical education at Riverview Medical Center, which is one of our sister hospital, part of Hackensack Meridian Health, and also a mentor at Thomas Edison University. I have over 30 years of experience as a nurse, 20 years of which is in the education department, and then 10 in nursing leadership position. Now, Dawn will be introducing herself.
Okay, hi, I am Dawn Williams. I am one of the directors of patient care services at Jersey Shore. I have overall responsibility for 6 nursing units as well as several programs that include the stroke service and orthopedic service and the bariatric service. I have a bachelor's degree in nursing with a master's degree with a certificate and focus on nursing administration. I have my national certification with the ANCC for cardiovascular nurse. I have more than 39 years of nursing experience with 16 years of progressive leadership. I am also an adjunct instructor with Georgian Court University, teaching behavioral health to the nursing students. Prior to this role, I was a senior manager of cardiovascular services here at Jersey Shore, as well as in our sister hospitals prior to coming here. And during that time, I implemented a STEMI program at one of our community hospitals. I developed an elective angioplasty clinical trial at one of our sister hospitals. And since then, I've been at Jersey Shore now for the past 8 years. The title of our article is Engaging Nurses in Scholarly Work.
Fantastic. Well, thank you both for sitting down with me today to talk about this article. Can you briefly give an overview of why nurses should read this article?
Yes, so nurses are the largest segment of healthcare workforce. We work in various settings closest to where care is provided. Reading the article would really help the nurses realize the breadth and the depth of their influence, as well as their vital role in creating positive changes that impact patient outcome and the practice environment. When nurses engage in scholarly work, they can identify more efficient and effective patient care options, address practice gaps, and influence patient outcome and experiences. These are very important not only to cope with the constant changes in healthcare, but also to share best practice and hopefully to continually inspire and sustain the nursing workforce.
Fantastic. So, can you tell us what made you want to write an article on this specific topic?
Yeah, sure, thank you. So we wrote the article to share our journey and learnings when we engaged our nurses in scholarly work. It started with our CNO, who challenged us to develop a program for our professional development to publish and present. Together, we co-chaired the committee on advancing scholarly work. At first, it was challenging to get engagement, as many of us went out of our comfort zone to write. This article is a testament that it can be done. No matter how overwhelming it may seem, it can be accomplished. Our hope is that after reading this article, others will be more comfortable with research, writing, and publication.
Incredible. So, obviously, it's such an important topic. What are 2 to 3 things you would like nurses to specifically take away from this article?
Yeah, so one of which is, as nurses, it's our professional responsibility to really bring best practice to the bedside, and one way is to engage in research and scholarly work. It may seem overwhelming at times, but it is exhilarating and professionally fulfilling when you publish your first article or do your first poster presentation.
Yes, I agree with Dawn. We want our nurses to realize that scholarly work is not purely for academic purposes and that the result of research and quality improvement projects help ensure that our current practice reflect the best and the most current approach to safe patient care. Scholarly work may sound intimidating, as Dawn had pointed out, and seems impossible to incorporate into the nurse's busy schedule. But with the organizational support and guidance, I'm pretty sure we could create a culture where scholarly work is an inherent part of the organization's nursing practice.
Fantastic. Well, thank you both for sitting down to talk with me about this today. We really appreciate it. And thank you again for writing this article for American Nurse.
Thank you so much again, Andrew, for
Yeah.
having us. It was our pleasure and great opportunity for me and Dawn.
Yes, thank you very much.